for 361 people. Right, see, folks are popping in.
And people can hear you too.
Well,
I just want to welcome everybody, and we are on a little short delay because the Congresswoman is just finishing up on the House floor with votes, although she is on her way back to her office for this webinar. My name is Joe Huang-Racalto. I'm Policy Director for NMAC, and I welcome you all. I'm going to turn it over to Harold, who's going to say a few words before the Congresswoman arrives, and then we will get started and let her give this very brief but important message. You can expect this town hall to last maybe 15 to 20 minutes. Harold?
good afternoon and good evening to those of you who've joined us. As I'm Harold Phillips, I'm the Deputy Director of Programs for NMAC. Thank you for joining us for this very important town hall meeting on the future of HIV prevention in the United States. And we are joined by Representative Waters, and we are so grateful that she is here this evening. Joe, do you want to do a few words of opening and welcome as she gets settled?
Sure. So we are we decided to have and invite the Congresswoman to this town hall because of the very fast moving developments within the CDC and perhaps over the entire HHS division. And what NMAC wanted to do is convey this first of many town halls that will continuously provide updates for to you from us on the developments that are happening. And we have set up a policy@nmac.org email. So that is policy@nmac.org, where you can now receive updates in real time, action alerts, if you will. All you have to do is email that policy@nmac.org with your name, affiliation, if you have one. Individuals are welcome to also submit their name and contact information. You will have a weekly or frequent update from NMAC. The rules for this are pretty easy. We have just a few questions for the Congresswoman because of her schedule, and for just a note, the 7:30 start time is because of respect to her constituents on the West Coast. So we felt that this would have been the best time for East Coast and West Coast folks. There will be, if time allows, we'll have 3 or 4 questions for the Congresswoman. The chats have been dislabeled. What am I trying to say there, Harold? They've been muted, really, as well as the other functions that you would normally see. And I see that the Congresswoman and her team are on. I will ask Kathleen or Ellis if the Congresswoman is ready. And I'll also text them. These are, yes, in one moment, they said, these are the kind of snafus we run into when you're up against votes and pressing issues on the floor. So we'll just hang for a second until she comes on, then I'll do a quick introduction of the Congresswoman, even though she needs no introduction. Yes, we can. Ellis and Kathleen, can you hear us, I guess? And again, if you would like to receive updates from NMAC, the email address is policy@nmac.org. That's policy@nmac.org. And we do appreciate your patience. Her team had just let me know that she will be ready here shortly.
While we work on this piece, there we go.
Congresswoman. Can you hear me, Congresswoman?
Yes, I can hear you very well.
Great. Good to see you again. My name is Joe Racalto, and I'm joined with Harold Phillips. We have many hundreds of people on this town hall. I will just say it is a pleasure to introduce you, Congresswoman Waters. You are indeed a true champion and a friend to our community. And for those that don't know, she is also the author of the Minority AIDS Initiative. Before I hand it over to you, Congresswoman, I want to let the attendees know that this is important. When NMAC got word of the potential CDC cuts exactly 1 week ago tonight, we contacted three people, Speaker Emeritus Pelosi, Leader Jeffries, and our friend, you, Congresswoman Waters. I will let the attendees know that without delay whatsoever, your talented team, Kathleen Senstock, and your Chief of Staff, Ellis McGinnis, they jumped right to action. And by close of business Tuesday, think about this, folks, Secretary Kennedy was in receipt of a very strongly worded letter from Congresswoman Waters, which prompted, by the way, other members of Congress to also write a letter about this very critical issue. This immediate action, or that immediate action from the Congresswoman, was necessary, and we are again so profoundly grateful to you, Congresswoman, and for your decades long of caring about this community. So without further ado, it is my pleasure, Congresswoman, to welcome you to this town hall.
And thank you so very much. Hello, everyone. I am so honored to join the National Minority AIDS Council for this timely and urgent town hall on HIV prevention funding. And I want to thank my dear friend, Joe Racalto, for that introduction. I've been proud to know Joe since the days when he worked for our good friend, Congressman Barney Frank. I also want to congratulate Paul Kawada, NMAC's executive director, for this wonderful leadership that he's provided at NMAC. I'm especially proud to be here with Harold Phillips, who is now the Deputy Director of Programs for NMAC and previously served as the Director of the White House Office of National AIDS Policy under President Biden. We're here tonight because Trump administration has announced plans to eliminate $1 billion from HIV prevention funding at the Centers for Disease Control and Prevention, that is CDC. This includes about $100 million under the Minority AIDS Initiative, which I founded in 1998. It also includes $220 million under the Ending the HIV Epidemic Initiative, which ironically was launched by Donald Trump himself in 2019 during his first term. As soon as I learned of this outrageous proposal, I immediately wrote to Health and Human Services Secretary Robert F. Kennedy Jr. to urge him to maintain funding for CDC HIV prevention efforts. Throughout my career, I've been a strong advocate for HIV and AIDS prevention, screening, and treatment, and I've been particularly concerned about the Black, Latino, and other disproportionately affected by the disease. That is why I led efforts in Congress to establish the Minority AIDS Initiative back in 1998, and I've worked closely with NMAC over the years to expand the initiative from the initial appropriation of $156 million in fiscal year 1999 to more than $400 million per year today. Like other efforts to fight HIV/AIDS, the Minority AIDS Initiative includes funds managed by several agencies within the Department of Health and Human Services. About $100 million per year is used by the CDC for prevention and screening in minority communities. $169 million per year is used under the Ryan White program to treat people in these communities who are living with HIV. Additional funding under the Minority AIDS Initiative is used by the Substance Abuse and Mental Health Services Administration, SAMHSA, to target minorities who face both substance use disorders and heightened HIV risk. Unfortunately, SAMHSA's HIV program is also in danger of funding cuts under the Trump administration. So regardless of whether we're talking about minority communities or other communities affected by HIV, prevention and treatment go hand in hand. I'm proud to report that during my time in Congress, we've made considerable progress in both prevention and treatment. HIV/AIDS is now a treatable disease. It's not a death sentence as it was in the 1980s, in the early years of the pandemic. Infection rates are also down, largely because of the work of the CDC. Every year, there are about 31,000 new HIV infections in the United States. That is down from 40,000 new HIV infections per year in 2016, when Donald Trump was elected president the first time. Eliminating prevention funding now will reverse years of progress. HIV prevention funding from the CDC is critical in maintaining life-saving treatment and prevention programs. Without it, many of the gains made in reducing HIV transmission rates could be lost. Many state and local HIV education, testing, and support programs and healthcare workers rely on CDC funding. Without it, countless people will lose access to life-saving services, and healthcare workers will lose their jobs. Every dollar invested in HIV prevention saves billions in future healthcare costs. Cutting funds now will increase long-term spending while exacerbating the crisis. State and local public health clinics are already overwhelmed. Further funding reductions will force closures, eliminate community-based HIV prevention programs, and reduce access to critical healthcare services. And so, we know that HIV disproportionately affects Black, Latino, LGBTQ, and low-income populations. Cutting CDC prevention funding will worsen health disparities and leave the most vulnerable communities without necessary resources for prevention and treatment. HIV prevention and testing technologies are only effective if communities have access to them. Federal funding is essential to ensuring equitable access to these life-saving tools. The fight against HIV strengthens overall public health infrastructure. Weakening HIV response efforts will hinder our ability to combat other infectious diseases. The United States has long been a global leader in HIV prevention. Cutting these funds jeopardizes our international standing and leadership in public health. The impact of HIV prevention cuts could be exacerbated by the loss of Medicaid funding. Trump's Republican allies in the House of Representatives passed a budget resolution that calls for up to $880 billion in cuts to Medicaid over the next 10 years. Slashing Medicaid will leave thousands of people who are living with HIV without access to health care when they need it most. Medicaid cuts will also devastate the healthcare system, leading to hospital closures, especially in rural areas. States will be forced to raise taxes, cut essential services, or both to compensate for federal funding reduction. We simply cannot let this happen. And so the Trump administration's plan to slash HIV prevention will be an existential threat to our nation's ability to combat HIV and AIDS. These cuts will directly endanger millions of lives by undermining critical HIV prevention services and increase the risk of a resurgence in new infections. I will fight this dangerous proposal, and I know NMAC will as well, but we cannot fight it alone. That is why this town hall conversation is so important. We need your powerful voices to ensure that this does not happen. I'll be happy to take any questions you may have. And thank you so very much.
Thank you, Congresswoman. Much appreciated those words. We do have a few questions. The first one, can you clarify, Congresswoman, what prompted your urgent letter to HHS Secretary Kennedy regarding the reported $700 million in cut to the CDC HIV Prevention Division?
Well, yes, I was alarmed by recent reports that the Trump administration is considering dismantling the CDC's Division of HIV Prevention, a move that would eliminate critical funding. This division plays a critical role in HIV surveillance, testing, and prevention efforts. My letter demanded clarity and accountability, especially since these cuts would disproportionately impact Black and Brown communities already facing higher HIV rates. We're now learning that the cuts could be as large as $1 billion, which is even larger than the $700 million I mentioned in my letter. However, I am encouraged that other members of Congress followed my lead and sent letters of their own. Congressman Mark Pocan and Congresswoman Robin Kelly circulated a letter with more than 100 members of Congress, and Congressman Mike Lawyer, a Republican from New York, also did a letter.
Yeah, we saw that. Bringing it back to Los Angeles, Congresswoman, what would be the impact on communities like South LA if the CDC's HIV prevention funding is slashed or completely eliminated for that fact?
Well, communities like South LA, already underserved in terms of healthcare, would suffer immensely. Without CDC support, local clinics and organizations could lose access to HIV testing kits, prevention education, and PrEP distribution. This would not only halt progress in reducing new HIV infections, but also widen health disparities. Our constituencies deserve better than to have life-saving resources pulled out from under them.
Yeah, we agree. Congressman, just a couple more questions, I guess. Given the CDC's role in monitoring HIV trends, how would eliminating its HIV prevention division affect the national and, frankly, local data collection efforts?
Well, the CDC's Division of HIV Prevention is responsible for tracking the number of new infections, transmission patterns, and disparities across regions and demographics. Without this infrastructure, we'd lose vital data used to target high-risk populations and tailor public health responses. Local organizations would be operating in the dark, No updated data means delayed or misdirected interventions. This threatens the very foundation of our public health strategy.
One more question, Congressman. We have many, many hundreds of people listening tonight. A question on advocacy, I guess. What immediate actions are you encouraging those here in the public and local organizations really to take to fight back against these proposed cuts?
Well, it's all about understanding, first of all, that this is real, this is serious. And oftentimes, when we run into problems, the people, many of whom are the beneficiaries, et cetera, will think, well, they have to straighten it out. This is different. You have now the President of the United States of America, who has unlimited power. Unfortunately, the Constitution doesn't say you can't do this, you can't do that, you can't do that. This is a very powerful position. And this president has discovered how powerful it is. And he has in his mind the way that he wants to so-called cut waste, fraud, and abuse. But they haven't identified any so-called waste, fraud, and abuse. We believe that he and many of the billionaires in this country have decided that they're going to run this country, and they're going to do it in ways that will literally create opportunities for them to reduce their tax responsibilities. If you take the money from all of these programs that they don't care about, and you use that to support this country, then the billionaires won't have to pay as much in taxes. And so, listen, Elon Musk and this Doge and all of this breaking into and running into our agencies and departments are not only brazen, they are absolutely committed to the proposition that they're going to run this country. And so I'm urging constituents, first of all, contact all your elected officials and demand that they protect HIV prevention funding. I also support advocacy campaigns by groups like NMAC and AIDS United, who are organizing rallies, petitions, and lobbying efforts. This is a moment for unified resistance, especially from those directly impacted, to ensure that HIV prevention remains a federal priority. When the word goes out, wherever you hear it, join the protest. Everybody can't get a letter or an email, but we're trying to get the word out as extensively as we possibly can. If you hear about it, come where we are. Come where the protests are. Join us. Get on the phones. Talk with people about it. And for some of these radio programs, even the right-wing radio programs, interrupt them. Call them. Don't just let the opposition control what is going out over the airwaves. Use your platforms. Everything united we must be with every effort, because, ladies and gentlemen, this is serious. This is a coup d'etat on our country that's being taken by the billionaire boys because they think they own it and they should run it, and they're not going to let up easily. We've got to fight, fight, fight.
Congresswoman, thank you. You're always so good to us. And by us, I mean the community at large, and we are indebted to you beyond words. We know that AIDS United is having their what is that?
AIDS Watch.
AIDS Watch this coming week, and there will be the halls of Congress will be flooded with advocates on Monday and Tuesday. So we are very grateful, Congresswoman. We're hoping that we'll see you at the United States Conference on HIV/AIDS in September.
Absolutely. Absolutely. Thank you so very much.
Which will be in DC. Thank you, Congresswoman. And if you all stay on, Harold will close us out. Thank you, Congresswoman. Ellis and Kathleen, we appreciate your help as well.
Thank you, Congresswoman, again, for using your platform and voice, and thank you for being on our side and for caring about the HIV community as much as you do. Have a great evening. Everyone, You heard it here. You heard the Congresswoman talk about using your platform and that now is the time to use your voice. There are questions that have been submitted in the chat about us making the transcript available. We will work on making sure that we can do that, make that available in some way to you. There have been questions about whether or not HOPWA is at risk, housing opportunities for people with AIDS, as well as the Ryan White HIV/AIDS program. And while we to date have not heard about potential cuts to the Ryan White HIV/AIDS program, we are concerned about the impact of potential cuts on Medicaid and Medicare, both serving people living with HIV and providing access to HIV prevention services as well. Also, when it comes to HOPWA, we have not necessarily heard about any cuts, but like Congresswoman Waters said, this is your opportunity to make our voices heard and to make sure that our elected officials all hear from us. Some of what we're hearing about in terms of cuts to the federal level, the Congresswoman also talked about the impact this will have on the availability. We know in a number of states, they do not provide dollars that go into HIV testing and HIV prevention. That means that publicly funded access to HIV prevention services will disappear in our country. So again, we encourage you to stay in touch, stay involved, and stay alert. I want to thank you all once again for joining us this evening or this afternoon for those of you on the West Coast. We really appreciate it, and future updates will be coming. Thank you.
Thank you, Harold. And again, if you want updates from NMAC, it's policy@nmac.org. We appreciate everybody attending and be safe out there. Thank you.